Hey, I'm Dr. Patel. I wanted to touch on the subtle but very important distinction between normal versus optimal. You may have been told during medical visits that your labs are normal, but I really wanted to emphasize how average or normal numbers in blood tests do not necessarily equate to optimal health for individuals. Standard reference ranges for blood tests are based on averages derived from a general population, and that includes individuals with different types of health conditions, different ages, and ethnic backgrounds. It's important to recognize that normal lab values are calculated based on a population average, and this average changes over time. In general, as Americans have become less healthy, our normal reference ranges have actually been adjusted higher and higher. This is not optimal, but this is normal for our population. Lab companies periodically have to readjust these reference ranges to reflect the new normal. For instance, a person might fall within the average range for markers like cholesterol or blood glucose, but still be at an increased risk for certain health conditions. These are great examples in which a personalized approach to interpreting results makes a huge difference. This is reflected best in weight in this country. In the US, for instance, average weight for both men and women has seen an upward trend since the 70s. In 1970, the average weight for men was about 166 pounds. And by comparison, in 2022, the average weight for men in the US has risen to approximately 197 pounds. Similarly, for women, the numbers are reflecting also about a 30-pound weight gain from 1970 to 2022. Now the average weight for women has gone up from 140 to 170. So normal or average certainly does not mean optimal here. Another example is liver function tests. Laboratories have increased the reference ranges as our population has developed more unhealthy diets as well as consuming more alcohol. These reference values have gone up by over 10% over the last 30 years because of our general health and the population has waned. Uh, we also see this with cholesterol management. Normal cholesterol numbers might be good enough if you don't have a family history of heart disease or aren't at risk for things like diabetes or dementia, but optimal cholesterol management really requires us to look at what those risk factors are, and your optimal targets may be significantly lower than what we consider normal today. At MD Longevity Lab, we look at each individual's comprehensive health profile, including factors like genetics, family history, lifestyle choices, and their specific health goals. Optimal health is not solely determined by whether markers fall within a standard range, but also by the context of an individual's overall health. Just because average weight for men and women has increased over the past few decades in many countries, it does not mean that we should consider this to be optimal for ourselves. Your doctor needs to know your particular risk factors to determine what is optimal for you. And that's exactly what we do at MD Longevity Lab.